So I'm looking at what's known as the perinatal OCD, or some people call it postpartum OCD, right? Perinatal OCD or postpartum OCD. So the OCD there is the what? Obsessive Compulsive Disorder. You understand? Now, for the best I can see from this picture, the woman gave birth to what? The love of her life, and she's obsessed. She doesn't even want to have time for herself. You understand? She's just thinking that something might happen to my baby. Something might happen to my baby. Do you understand? She's getting too worried. Yeah, it's actually stressing her emotionally. So it's a form of what? Obsessive compulsive disorder, but this one is because of in the pregnancy. Most of the times it's the first year after childbirth, and most of the times maybe, it's the first time a woman is getting pregnant. Yeah, it could also be because of maybe her previous experiences with what? Pregnancies before. Maybe she has lost babies. Do you understand? So what it involves is obsessions, unwanted intrusive thoughts that often center about the baby's health or well-being. So she's so disturbed that something might happen to her baby. Fear of harming the baby accidentally. She's worried about any sickness that might come up in the baby. Maybe she has been seen around. People lost their babies due to sickness. So she's so worried. And all these things are coming in maybe just because, the woman has not been properly enlightened. So you just trying to educate women about what happens during pregnancy, it can help a lot. Okay? So compulsions. So repetitive behaviors, excessive cleaning. She's just cleaning everywhere. This is because she's running away from infections, right? Constantly checking on the baby, avoiding certain situations or people. So please, you can pause here to look at a summary of what this postpartum OCD simply covers. Alright, just centered around fear. Okay, so who it affects occurs most time in first time parents, or she has had other pregnancies and she has had a bad experience with them. It's triggered by hormonal changes, sleep deprivation, and stress. Affect both women and men. Okay, so treatment options is just cognitive behavioral therapies, especially exposure and responsive prevention. Medications that will help you deal with what? Anxiety and depression. Then you should link up with all those your groups, all those your friends, and all of that. Okay, just to actually brighten up your mood again. So that's just what the postpartum OCD or perinatal OCD simply is.